Flattered and a little scared to deliver something like this because I really wasn't expecting this. Um, I was approached by students and asked me to do this, so I said I would. Straight here? Okay, it's better. Does that look better? Does it look all right? Thank you. So I thought the theme would be what's different about being a nursing professor as opposed to other professors. I've been in higher education for over 30 years. I've been at Westchester for 17 years. So what's different? What makes it different? Your students have all had teachers from all the different disciplines that you took to get here to nursing, but you may not realize what it takes to be a nursing professor. So for my nursing colleagues, some of this will be familiar to it, and some of it will be unique to me. Start out with the 40-year experiment because it was actually 40 years ago that I started as a nursing major at the University of Delaware. I had been a biology major for a couple of years, and I liked biology a lot, but I didn't know what I was going to do with it. And luck had it that I ended up having a biology major as a roommate who is currently a biologist. And I realized meeting him and having him as my roommate that I was not cut out to be a biologist. I needed something else, and I didn't know what. Now, this is 40 years ago, it was 1978. So I was in a co-ed dorm, and one of the gals across the hall who knew me said, and I told her I was major shopping, she says, I think you should be a nurse. And at the time, it seemed a little crazy, but the more I thought about it, the smarter it seemed. It seemed like I think she was right. She had some insight, I think, into my own personality. And so I said I would do it for 1 year. And I'll keep doing it for 1 year until I don't like it anymore. Well, that was 40 years ago, so that's the experiment, is that for 40 years I continued to be a nurse. I finished at the University of Delaware in 1980, and I went to Children's Hospital of Philadelphia and became a nurse in the oncology unit there. That's where I met my wife, Peg, who's also a nurse, that romantic setting of oncology. And so I worked there for a good number of years, and my next thought was to be a clinical nurse specialist. And so I went to graduate school back at the University of Delaware. And while I was, as a graduate student, I got an opportunity to start teaching some of the nursing labs, which were very much like the nursing labs that my students have been through today. A lot of things are still the same, a lot of the tasks and things you practice. So I went to back for that, and I was asked to teach these labs, and I did it, and I liked it. And so I started having in the back of my mind that maybe I'd like to do some more teaching, but I was still going into this clinical experience. And one day, I was going through the University of Delaware. I had just finished graduating with my master's degree. I think I was in shorts and a t-shirt, and the chairperson said, "Brent, you want to teach nursing for clinical nursing in like 3 weeks?" And they had a clinical instructor opening. Somebody had dropped out at the last minute. We know about that in our department, don't we? So I said yes, and so I went to DuPont and started working there. And I was working at Children's Hospital and working for the University of Delaware. Then I started getting a part-time job at DuPont and Children's. And then at one point I even added in, and I'm looking back, I'm trying to figure out why I did so many things at once. I still can't answer that. But I also joined the Delaware Air National Guard as a flight nurse. It seemed like fun. Little did I know, just a few years later, I'd go to a war. It's now the 27th anniversary, I think, of the end of that war. So I started teaching at University of Delaware, taught at Delaware for 10 years, full time. And then I went to Rutgers for 4 years in Camden. And then I was at a Sigma Theta Tau meeting. I was president of the Eta Beta chapter at Widener. And somebody came in to the meeting and said, Carol Matz is retiring. Well, Carol Matz was the pediatric instructor here at Westchester, and I had known her for many years because I was the Delaware teacher and she was the Westchester teacher. And so our paths crossed all the time, and I knew her. So I sent a CV to Ann Stowe the next day. They hadn't even posted the job because I said, I think I really want to be at Westchester. I had a reputation for for emphasizing teaching. That was something that I wanted to be a part of. So I applied, and fortunately, I got hired. That was 17 years ago. So the experiment continues. I have now, after 17 years, I have an opportunity to retire and continue my medical benefits. And so I'm trying to see what comes next, and I'll talk a little bit about some of my hopes and dreams. So the other thing about being a nursing professor that maybe people who aren't nursing professors understand is that you live a dual life. You have this profession of being a nurse and a profession of being an academic. And you have to live them side by side, and you have to deal with those issues every day. You have to bring along students and trying to get them to be nurses, but you also have to be an academic, and you have to be doing research and writing and getting grants and doing all the things that you're expected to do in higher education. So you have this kind of a dual life that is different because we also spend 40% of our week in a work week, 40% of a work week, not even on campus. So for 2 days out of the week, I drive this semester, I drive to Newcastle, Delaware, and I have a group of students that I take to the school for special needs children down there. When we're there, I'm functioning as a teacher, but I'm also functioning as a nurse. So again, that dual role there. And that's something I think a lot of other professors in other departments may not realize. You know, even some of the other practice professions, like we have communicative disorders and things like that in Westchester. You're at that clinic, and you do have a bit of a dual role. But we're really traveling and going to a lot of different places. The other point is that clinical teaching is really a high wire act. There's not much of a net, and I hope that's something that people who aren't nursing faculty learn to appreciate. Because I remember talking to our clinical is listed in the catalog as laboratory. Now, in most cases, laboratory is a carefully prepared, carefully thought out experiment. And the students will come and do something, and the chemistry professor, for example, will know exactly what's going to happen and give the students exactly what they need, and they're going to write it up, and they kind of know what the parameters should be. Nursing faculty do not have that luxury at all. We come in our high wire. There is no net down there, and we have to come in each day to see what is on the other end of the wire. So we have to make clinical assignments. We have to determine which assignments would be best for the students. We have to be diplomats because we're the guests at our clinical sites. It's not like the lab here on campus that you own it and you run it and you get to determine what happens. You're a guest there, and you have to make sure that everybody stays happy, which is very hard to do. You have to have enough clinical education to know what's a good assignment for students, what they can handle and what they can't handle. You also can't be hovering all the time around the student. You have to give them a chance to learn their own practice. So you have to give them enough rope each day, let them out on the wire, And so just enough rope, not to hang yourself, but enough rope so that you can feel some measure of independence and be learning the things that you're expected to learn. So it can be very, very frightening because we have a nursing license that expects us to know what's going on and expects us to do things in the correct way, and yet we have 8 nursing students who try their best, but I can't see all 8 at one time. And so I'm always thinking in the back of my mind, okay, I got one of them in front of me, what are the other 7 doing? You know, in their rooms, and I don't know. So it takes a lot of trust. So that's the other part of being of that high wire act, is you have to put a lot of trust and a lot of faith in your students that they'll do the right thing. And 99.99% of the time that they do earn your trust. It's always been. And of course, teaching nursing has high stakes too, that I don't know if all other faculty at Westchester in other disciplines realize, is that our graduates have to pass the nursing licensure exam at the end. In the health sciences, we have a lot of different licensing exams that students have to pass. But in a lot of the other disciplines, and of course we don't have a lot from other disciplines here today, but people from the other disciplines may not realize that what pressure you are under as a nursing faculty member to make sure that the students get everything in that they're supposed to get in. So I remember taking classes in history or something like that. At the end of the semester, we didn't get to that last module. Well, we just didn't get to it. But we don't have that luxury in nursing. We have to get to everything that's required, because our students, after graduation, are going to be tested on it. And we have different bodies, both the state and private accrediting bodies, that are watching what we're doing and have to make sure that we're doing things right. So we have a lot of eyes looking over our shoulders all the time that you don't have in a lot of other disciplines. The other thing is, I think nursing informs my teaching as well as the teaching informs my nursing. So what does that mean? Well, in nursing, one of the things I learned a lot with patients as becoming a nurse is empathy. You have to really try to put yourself into the place of the person that you're taking care of. And so one of the things I've always tried as my central tenet as being a teacher with my students is I try to be empathetic to them. So when I'm planning a class, I try to put it from the point of view of, I don't know anything about this topic. How can I best organize it? How can I pull out the most important points and build on them so that you'll have a good basis for understanding. You still have to do the readings. You still have to do that other stuff. But what I hope to do is to guide you that, so when you're doing those readings, instead of just being 75 pages of everything that seems the same, you'll now see in the 75 pages what's important, what do I need to focus on, and what does it mean. So empathy is what I try. And then teaching informs your nursing, because I also believe that one of the biggest roles that we have as nurses is teaching. We have to teach our patients all the time, and we do it sometimes. We have the students do projects that are very formally prepared, but what I also try to get across to students is you always need to be teaching. You always need to be talking about what's happening, what's going to happen, why things are being done. Do they understand that? What are their goals? And try to see if you can help them reach that. So I think nursing makes me a better teacher, and I think being a teacher makes me a better nurse. The other thing I've learned over the years is that teaching, I think, really is a group activity, but learning is something you still can only do yourself. I cannot open your heads and pour knowledge into it. I can present things to the group. We can have a lot of fun activities. We do, in my classes, we'll do case studies and those kinds of things. But in the end, it's still up to the individual student to do the learning. And sometimes students don't realize this. They want to treat it like it's a movie. Okay, make me learn. And it doesn't really work that way. One of the big trends now in education is the flipped classroom. The idea is that you turn more of the work back to the students. They have to do the work. The downside of that, particularly for new faculty, is that a lot of students don't like it because they're not used to that. They're used to coming in, sitting in a lecture, watching this guy up on the stage. They call it the stage on the stage. And instead of being the guy on the side, where I stand over on the side, I give you work to do, and you do that. That's really the trend. Because one of the other things I've learned is that in all these years, is that BSN is still a 4-year degree, and yet in those 38 years that have passed since I graduated, there's a whole lot more information to learn, but it's in the same amount of time. So I've really come to the conclusion that the only way you can learn as a nursing student in 2018 is you have to put in the work. You cannot memorize everything that you need to learn. You need to learn how to use your resources that you have. Now that you have internet access wherever you are, you can do things, you can get a hold of things that I couldn't. When I was a nursing student, the library, you went to the CNOL book and you looked through references at the subject titles, and then you went down into the stacks and tried to find an article. And now I can just press a button and there it is. So things come to me in seconds that used to be literally hours worth of work. And so we need to, I think students, today, that's an important skill to learn. Is how do I find the resources that I need as I need them? And not just think I'm going to memorize everything I need. Because so much of what I learned in the late 70s as a nursing student isn't even true anymore. We don't do some of the procedures the same. There's hundreds of new medications, new procedures, new machines. Everything is new. You're always learning. So you don't graduate as a nursing student and say, okay, now I'm done. I don't need to learn anymore. No, you're just getting started. And I think that's the other thing that I know my fellow faculty all agree with. Another concept that I try to teach my students is everyone is your teacher. I might be the official teacher up here, but when you're with your patients, they're your teacher too. Because they're teaching you something about the experience of being ill, whatever their life experience is, how they're coping with it, how they're dealing with it, and they're teaching you about that experience. And I also think that everybody that you meet in your clinical experiences is also your teacher. And that means the person cleaning the floors, changing the beds, from the head nurse to the president of the hospital, they're all your teachers. So you respect everyone you meet, and you try to learn from everyone you meet. And I just think it's a good way to go through life. If you think of everybody as your teacher, then every day you grow. Because learning is changing. Every time you learn something, you've changed. You were not the same as you were just a few minutes ago before you learned that. You're now a different person. So every day you become a different person. And if you do that actively by looking at everybody as your teacher, then you can enjoy every day because you're now a little different than you were the day before. And in the end, I think it's a privilege. And I think, it's really an honor to be a teacher and a nurse. You guys trust us to give you what you need to be a registered nurse so that you get to go out there and be a nurse. And for my patients, it's a privilege for me to be able to be a part of their life, to be able to meet them at some of the most vulnerable times of their life. You're with people when they're born and families that are just being created. You're being with people when they're sometimes at their very worst and lowest points of their life. You're sometimes dealing with death, which sometimes is horrific and sometimes it's welcome. But you're dealing with people in all stages, and it's a privilege to be able to be a part of that. Because the other thing I try to communicate to students is you would not know these people if you weren't in the position that you are now. Think of how much you've gotten out of the experience and how you were able to help them. And so, it sounds selfish, but you get a lot of good feelings and a feeling of being useful and being a productive person when you're doing that. The other thing is, and this is something that I learned 38 years ago as a nurse in an pediatric oncology unit, is don't expect things to go according to plan. You still need a plan. You don't just say, well, I don't know what's going to happen, so I'm just not going to worry about it. You kind of have to plan, but you never know. And I got that philosophy because I was dealing every day with parents who had small children diagnosed with cancer. In many cases, it was potentially life-threatening. And I used to, before then, just sort of figured my life was going to go exactly as I planned. I was going to have this degree, I was going to get this job, I was going to get, everything was going to happen exactly as I wanted. Working with those families, I realized that you can't do that. So you always have to plan for the best, hope for the best, and plan for the worst, I guess is what they say. But also have some plans, have some directions, have some things that you think personally you want to do. And that's kind of what I'm trying to get to in my next chapter. I have some plans, but if they change, I understand that too. The other thing, in particular, I want to tell the students this, is make your own luck. And that is, well, sometimes you think, well, they got that because they're just lucky. Sometimes, though, if you go back and you look, you'll see that people put themselves in a position of luck. So, for example, if a student wants to be in a particular area in a hospital, but they don't want to put new graduate nurses in it, I say, make sure you get a job in the hospital that has the unit that you want to be on. So when it opens up, you'll be there, and you can apply for that, and they're going to hire from within first, so you make your own luck. Networking, keeping in touch with all of your alumni, with the people that you've worked with. Don't burn bridges, and you'll find that things will come to you. A lot of people who are very successful in a lot of businesses never advertise. It's all word of mouth. So the word gets out that you're somebody who can be trusted, you're somebody who's good, you will get work. You will find new things you didn't even plan on can come your way. But it's because you did the groundwork and you put yourself in a position to get what's sometimes just referred to as luck. The other thing here, this equation, 3.5 times 17 equals 60, is because 17 years ago I weighed 60 pounds less, and I realized that just by gaining 3.5 pounds a year for the last 17 years added 60 pounds to my frame. So, just for those of you who think, oh, it's looking on the scale every January 1st, it's just a few pounds. One of my hopes in retirement is to do some subtraction. So that's all I have, but I just wanted to leave it open to any questions or things that maybe you have for me after hearing. Yes? What is your plan? Oh, my plans. Okay. Well, you know how I like technology and all of that kinds of things. I've been in talks with a company in media called Unbound Medicine, and they do Nursing Central software. And they're trying to get more involved with the nursing education market. And so they've asked me to be a consultant with them in the fall and do some work, and I've come up with some ideas for them to help them sell their software. But I'm also doing it because it goes back to what I was saying is that I believe that software that you have on your handheld computers, the references and things, are things that students need to start using more in class and more in clinical, because you can't be expected to memorize everything. So I'm looking at this as an extension of the work that I've already been doing. I'm hoping to do some online teaching so that I can live anywhere. I have a summer place in Maine already, a little cabin up there, so I'd like to be able to just stay out on the island in the summer, but still earn a living. And maybe someday move to Florida. Next week I'm going for spring break down to Florida. I'm going to look at some houses down there just to get a feel for the real estate market. And just going to see what comes my way. You know, you never know. I want to do some practice work. I've always been interested in hospice, so I'd like to do some hospice hours. But it's very hard to do it full time. But I think I could do it part time.
Can you tell them what it means to have gone on to get a PhD and stuff?
Oh, getting a PhD.
Yeah, going on to you talked about taking your own.
Yeah, I kind of skipped over that part of the story.
What kind of doors opened up?
Yeah.
Continuing education, that stuff.
Yeah, you pointed out the flaw in my story. Yeah, I had that master's degree, and I was teaching at University of Delaware, and everything was going along fine as far as I was concerned. But the dean down there said to me one day, "Do you really want to be a teacher as your career?" And I said, "Yes." And she said, "Well, you really need a doctorate to do that." And that was a pretty frightening thought at the time. And at that time, there weren't a lot of doctoral programs even available for nursing, but luckily there was one at Widener, which was nearby. So I signed up for it. That was in 1990. Now, in February of 1990, we adopted Laura. I started at the doctoral school at Widener, and then Saddam Hussein invaded Kuwait. So I got activated and went to Saudi Arabia. So that was a crazy, crazy year. But I got that degree finally, and as Ronnie said, the world really opens for you in higher education once you have a doctoral degree, because now you have a lot of opportunities, a lot of jobs. And I know for when you're a nursing student, you think, well, I'll never be doing that. But I was exactly the same way in the 1980s. I never pictured myself doing that. And a lot of people, I would say, with doctorates probably would say the same thing. They didn't see themselves as going down that route. Because when you come out with a practice-oriented degree like nursing, you just see yourself as trying to get socialized into being a nurse. That whole idea of having this other branch, you might be way in the back of your head, but it just doesn't even seem that feasible. Yes?
What was the most rewarding experience with either a child or a parent with pediatric oncology?
For me, in pediatric oncology there was a child I had taken care of for a long time. One of the things that happens in oncology is the patients come in, they get chemotherapies, and then they go home, and then they sometimes come back with complications because of the effects of the chemotherapy. And so I'd taken care of this boy for a long time, but unfortunately the chemotherapies weren't working, the treatments weren't working, and he was getting worse. And there was a period of time where I was off. You're not working every day, but I was off, and the child died. And his parents called me to tell me this and thanked me. And that, I just couldn't believe that they would think of me. That was probably the worst day of their life. So I think, doing that makes you realize just how important the work is and how rewarding. I don't think there's anything more rewarding. Thank you for making me cry. Anybody else want to make me cry? Yeah.
Between growing up for teaching and being partners, which would you say is your favorite or like some highlights of
Well, I really don't know, because the fact that I do all those things means I like a lot of different things. I like a lot of variety, and I like being able to go back and forth. I loved my days as a flight nurse. I think it would kill me today if I had to do it. It's physically very demanding. And I don't think, with that calculation that tells you right now, I don't think they could find a flight suit big enough for me now. But I love that, and I'm very grateful to be part of that. But, in the English language, we have the word love, and it's just that single word. But you have so many different kinds of love. I love my wife, I love my kids, but I also love my students, I love my patients, I love my colleagues. But they're all different ways. We just don't have enough right words for the different kinds of love that we have. So I love all the things that yes.
So we're all kind of nearing the end of our nursing education, and it's time to choose a specialty or start looking for jobs. And it seems a little scary because you have like your ideal field.
Oh, yeah.
And then you realize you're probably not going to get that. You're just going to apply somewhere and then you'll put you somewhere.
Right.
How
How do you?
which specialty, which field, process?
Well, I did not choose pediatric oncology. I knew as a nursing student, I didn't even think about pediatrics all that much. My favorite classes up until pediatrics was psych. I wanted to be a psych nurse. And then I had a pediatric rotation in my senior year, and I really liked it. And I applied to children's. And I got the job, and I had asked to work on the adolescent unit because I thought that would be where I was most comfortable. They called me and offered me oncology. So they saw something in me that said that I would work well there. So I said yes. So part of the answer is put yourself in positions, but be open to whatever comes along. If you don't like it, then one of the nice things about nursing is every experience you get builds and only makes you a better nurse in your new experience. So don't just do it for 2 weeks and quit. But if you spend a year or 2 years in something and then move to another area in nursing, you're only benefited by having that different experience. I would answer the question more directly by saying, make your own luck. Put yourself in a position where if you don't get to your dream, what gets you closer to that? What kinds of things can you do to get close to that? You can also join like the nursing professional societies. So let's say you want to be a pediatric oncology nurse, but you didn't get hired in that. You can still join the Pediatric Oncology Nursing Society. You can find out about it. You can network with other nurses. You can find out about jobs and things that become available. You can find out what's the best way to advance into it. So in the end, I always tell my students, don't think you have to go to a certain area because you're a graduate nurse. Follow your heart. Where you have all these experiences as a nursing student, where is it that you liked most? And it doesn't mean you're going to work at the Leach School in Newcastle, but what is it that you like about that experience? What didn't you like about it, too? That's just as important. What did you like? And try to find something that fits you, because everybody is an individual. And the wonderful thing about nursing is that there seems to be a niche for everybody. Okay? Yes? Developing confidence? Well, the only way to develop confidence, see you in Florida. Be down there next week. I would say it's just time. You can't walk in and think that you're going to be an expert in the area. So I say what I would say is ask lots of questions. Don't be a know-it-all. If you're not sure, just keep asking those questions, and you get those questions answered. Follow the advice that they give you, and then ask more questions. And then over time, an amazingly short period of time, actually, you develop a lot more confidence in what you do. As a nursing student, you kind of come in and you're just doing these little flash visits. But when you start going every day, and spending more time and start to see patterns, then it all makes more sense. Anything else? I appreciate you all coming out to hear me today, and thank you